Hello, Gary Perkins from Sussex First Aid Courses, and I would just like to spend a couple of minutes with you talking about the presentation of adrenaline 1 in 1000, regards the auto-injectors, how to use them, the common mistakes that people make. Also, I'd like to talk about the ampules 1 in 1000 that dental practice or medical clinicians, whether it's a GP practice, may need to use. I'm also going to demonstrate how to draw up and actually inject somebody who may be suffering from anaphylaxis. So first things first then, anaphylaxis, a massive allergic reaction. If you're seeing somebody, you have a patient who's got an onset of a rash, maybe breathing difficulties, itchiness all over, blood pressure starting to fall, breathing difficulties, that is a sure sign of anaphylaxis. So first things first, where in doubt, if you believe somebody's suffering an anaphylaxis shock, then use your auto-injector or draw up your 1 in 1000 from your ampules and use the medication, and of course call 999. Now, within your medical kit, are you rescue ready? Ideally then, your adrenaline 1 in 1000 should be ready in a rescue ready kit. We supply them ourselves. You can go onto our website, have a look on the shop page regards this. So have everything in the kit ready, color coded, and importantly, have the drug dosages ready. You do not want to be left there trying to treat a patient, trying to decide what's the drug dosages. So first things first, the most common one on the market is the auto-injector EpiPen. Now this has been around a long time. It has a pediatric dose, 150 micrograms, and it has a child dose at 300. There is no adult dose. However, if you only have the 300 dose, then you should use it for an adult in a medical emergency. The presentation wise of this is it is in its yellow box there. There it is in a safety container. And a couple of things you need to be so aware of regards the EpiPen is the fact that many people make a mistake when using it. They tend to get a little bit confused. One, they're a bit flustered. Two, they're not reading the instructions that are on the side there, and they get a bit panicky. This is the EpiPen. Yes, it does have a, can you see that, a black arrow down there? Trying to indicate you is the orange that goes to the thigh, okay? Remember, blue to the sky. I'm not going to use this one. It's a real one. It's in the container there. Ideally then, here's a training one. There it is. You've got somebody who's got into anaphylaxis. Lay them down before they fall down. Raise the legs to help the blood pressure if need be. Grab the pen, hold it like so. Don't put your thumb over the top. Many people do make the mistake of panicking and they have their thumb on the top of here. If you go to use that by pushing, the needle is going to go in your thumb. So try to remember, blue to the sky. Take off the safety catch, and now it's ready for use. And here you would be going into the outer mid thigh of the person. So I'm going to use, I've got a training IM here pad. If this is the thigh of the person, you want to go in firmly and hold. I'm going to say for 5 seconds. The guidelines now say 3 seconds. However, many people get a little bit flustered in a medical emergency. So there's nothing wrong for holding for 5 seconds, and then you're allowed to take away your injector. So just remember, please, when you apply, hold for 5 long seconds. Then you can take it away. Single use only. Monitor your patient, and over the next 5 minutes, monitor their breathing. And the breathing's improving. If their blood pressure is starting to return, they're going to start feeling a bit better. If they start to deteriorate, blood pressure disappearing, breathing's deteriorating, wheezing, swelling of the airway, they're getting worse, consider using a second dose if you have another pen. Okay, and of course you've got to call for help at all stages. Secondly then, in most medical practices and certainly in the dental world, you should have ampules, adrenaline 1 in 1000. Presentation wise will be ampules like so. Ampules are cheaper, they last longer to keep. However, I will say when you go to use them, they can be a lot more fiddler. And there you go, there's your ampule, there's what it looks like. And can you have a look? Can you just see there's a little blue dot on the side there. There are different ways to open up ampules, otherwise if you're not careful they do shatter everywhere. So I'm going to show you my way. First things first, if you ever need to use an ampule, first things, we've laid the patient down, raised the legs, oxygen therapy if you have it to hand, you've called 999, and now grab your adrenaline 1 in 1000. Check the date, check the dose. The medication's probably gone to the top of the ampule, and we don't want to break it, otherwise you're going to waste your medication. So just give it a little twirl, and the medication will now drop down. There's the blue dot. I'm having a blue dot towards me. Inside your kit, you should also have a safe snapper. Many of you have probably used your hands or a bit of lint in the past. Trouble is with that, often it shatters and breaks, and then you get an injury yourself. So you do need to put the snapper on top. Blue dot towards me, snapper on the top, and snap away. There you go, a clean break. Once you've done that, in your kit, you should have a 1 ml syringe. Not 2 ml, not 5 ml, because it's 1 ml of fluid in the ampule, and we do not want to make a mistake with the drug dosages. 1 ml syringe then. Ideally also, folks, you need to grab a draw up needle. I know many of you have probably used needles in the past, and the trouble is when you go to use a needle to draw up from an ampule, guess what? You're going to get a needle stick injury. This has a filter inside, so when you filter up, if you did break the glass, it does filter. So very swiftly draw up the appropriate dose. So if you have your drug kit, you need to know the dosages. Draw up the appropriate dose. I'm drawing up for a child at the moment, which is 0.3 ml or 300 milligrams, okay? You don't have to over worry about bubbles being inside. This is an IM injection. We would never give 1 in 1000 IV. It's always going to be IM, okay? Inside your kit, you also have a range of needles, green and blue. General use, we're always going to go for the blue one there. It's a little bit smaller. Okay, there we are. We've popped on the needle. We're now going to go to the outer thigh of the person, or we can go on the outside midline of the arm there, the upper arm, and we are going to go very firmly IM into the muscle. You do need to be firm. You will feel the muscle. Just pause there. Inject. Squeeze the skin together, and now take out the needle. Now I'm squeezing it together because when I put the injection in the needle, I've created a channel, and when you take it out too quick, sometimes what you see is your medication shoot across the room. Okay, so hold it in, allow it to be absorbed over the next five or so seconds, and now you can give a little rub for 10 seconds to try and help with the absorption. Monitor your patient. And regards your adrenaline 1 in 1000, you should repeat the dosage every 5 minutes all the time the patient's deteriorating. So give the prescribed dose, mark down the time, watch the clock. If they're still deteriorating, 5 minutes on, second dose, and then a third dose if need be. If you get to the point where the patient has gone into cardiac arrest, stop administering a 1 in 1000 and immediately concentrate on CPR, resuscitation, and use of the defibrillator. Okay. I hope that's been of help to you. Just give you a good idea into the general use and administration of 1 in 1000. Try to remember, if in doubt, always use. Never hold back, and call 999 as soon as you can.